and welcome everyone to today's talk. We have Dr. Sulakshana Nandi with us. She has done a PhD from University of Western Cape, South Africa. She's also the co-chair of People's Health Movement. She's based in Raipur, Chhattisgarh, and associated with the People's Health Resource Network. Ma'am, today you will be you are going to speak today on public health and policy level interventions, especially in these times of COVID-19. I hand over the space to you now and will request for your presentation. Thank you so much.
Yeah, thank you, Atul. My presentation will be mainly based on our experience in India and what we as People's Health Movement India or Jan Swasthya Abhiyan have been responding to and studying and documenting. But I'm sure that it would also have relevance for countries elsewhere. And I'll try to bring in maybe some comments on that. I know, you would be aware of what public health is, but I thought just show this slide so that, just to impress upon the fact that, public health entails a huge, enormous sort of which includes from specific health care interventions in terms of prevention, promotion, and healthcare delivery. But it also deals with, who is getting healthcare, whether the most vulnerable are getting healthcare. There is a concern for health equity. And even though the focus is on whole populations, rather than individuals, but the issue of vulnerable individuals, marginalized people, or whether groups have been left out or have been unable to, for some reason or the other, or are being discriminated against. So that's also a major part of what public health should be doing. Alongside the other determinants of, the socioeconomic determinants, the political determinants, because a lot of the policies, for example, really depends on what kind of a government you have. So that and how that government or plans its public policy, its public programs, its public services, and public systems. We'll talk about that a bit later. Alongside that, the community is also very central to public health. So the kind of participation, not only in accessing services or, relief, as we're seeing here, but also being sensitive to what the community need is, and also involving community in planning and monitoring whatever measures or public policy being implemented or planned for. And in all of this, the role of the state is supreme, and the state has the ultimate responsibility of ensuring public health for all. And public policy is like an instrument that the state should be using to ensure, public health and health for all communities and individuals. So as we sit here in this present crisis, I want to, with this background, I want to start talking about the kind of crisis that we are in, that we are seeing in India, especially the context of India. So we are seeing a number of interrelated crises which are happening at the current moment. So one is your health crisis with this, with the epidemic and the medical aspects of, the infection and the way it's being transmitted, or so the medical aspect of it, the health crisis. And then we have a health systems crisis, which deals with how prepared our health systems are to deal with this health crisis. And then we have a social and economic crisis that we are seeing, which to a great extent is as we've seen in India to a great extent, is actually a result or has been exacerbated, by the lockdowns and the other policies of the government that has prevented the workers in the unorganized sector or daily wages, the shops, the self-employed, the fisher folk, the forest collectors really destroyed their livelihoods, and they're facing a huge issue of hunger and starvation as we're seeing it. The other thing that I think we speak less of, but which really is also at the core of our public health crisis, and which, if not dealt with, will actually end up in really again exacerbating this whole crisis and really undermining any other effort that we do in this regard. That is high levels of stigmatization and brutality that we are seeing with people who are suspected to be COVID positive, or the ones who have COVID infections. So this is this is like interrelated crises that we are dealing with at this point of time. And in terms of public policy and the response of the government, it's important to remember that the public policies on the above may have exacerbated some of this further, and also that the past policies of governments actually determine the preparedness and the responsiveness of the system towards this crisis, as you would yourself you would see in the differing responses and the differing effectiveness of responses within different states within India. So we start with the first crisis that I just want to highlight, which is the crisis of health and the health systems. So there has been a lot of issues and a lot of critique on government's way of dealing, or government strategies on dealing with the COVID-19 pandemic. I mean, the Indian government, from beginning from the kind of testing protocol that was set up initially and slightly expanded subsequently, the failure to make protective personal protective equipment available or supply or produce different kinds of equipment and masks that were needed even for the frontline workers and health workers who are still working with patients. So alongside that, also there has been a lot of criticism on the way the contact tracing and things like that have not been done as effectively as it should have been done. Alongside, and it doesn't help that the government is also quite non-transparent about a lot of the numbers, a lot of its strategies, and we really need to keep in mind, that even in normal terms, I mean, even in normal times, if you say that, public policy is actually determined by a number of, there's a lot of politics within which public policy is determined, and there are a lot of conflicts of interest, and there are a lot of interest groups that try to move a strategy or move a sort of an intervention in a particular way, and we all need to be very vigilant, of that, even when we are dealing with the pandemic, and we need to try and see where this particular recommendation is coming from, who is benefiting from that recommendation, who's losing out from that recommendation. So that's very important. The second thing is about the health system, and we've heard this word, health system preparedness. Like we see in India, in most states, the health system is quite unprepared to deal with the crisis, and a huge reason has been the decades of neglect and under-resourcing of the government sector, which include from lower financial resources to not recruiting the adequate number of health workers, doctors that were required, and literally just trying to sort of outsource your health services, the health services to the private sector, with has its own profit making motive, which really undermines the social good or the public good motive that should come out of a public good like healthcare. So yeah, so even here we find differences within the states. For example, states which have traditionally had strong public systems, when we see Kerala, and to an extent we see Tamil Nadu, and we find that their sort of system of or their effectiveness of responding to the epidemic is certainly much better, than states like maybe Uttar Pradesh or Bihar. To give an example, like in Bihar, I don't think they. I think the testing numbers are the least in Bihar, or I think they're not doing any testing, and very few numbers of testing. Then there are some states which are in the middle, which maybe were did not start with a very strong health system, but some states have started doing some proactive, work in dealing with this crisis. But generally, overall, if you look at the Indian public health system, we find that, it really comes to sort of haunt us, the kind of neglect that the public health system has faced, and we are facing all the negative consequences in this crisis. And you must also understand that a crisis also requires very urgent, immediate responses, and there may not be enough time for the health system to be strengthened, in order to strengthen, in order to respond adequately to the crisis. So the lockdown, even was supposed to, in some sense, supposed to provide that time health system to recover or prepare itself, but we have seen from many states that that's really not happened. That it's a huge concern for all of us in the health movement on how the states are going to go about in responding to the crisis. So one of the things some states have done is about trying to requisition public, private sector hospitals, and but here too we find that it's been done in. There are different types of arrangements that are happening. So a lot of it is also the state paying for these services in the private sector, which is often also very expensive. Alongside that, you have institutions like the World Bank, who has just given a huge amount of money funding to India, but also talked about setting up isolation wards in the private sector. So what some of us are assuming that despite what is happening, one opportunity from this crisis could be governments to realize that the public health system needs to be strengthened, and hopefully the government will be doing that. Unfortunately, some of the responses to that has been to the contrary. So in which, when you have money coming in, it's also there's hope for it to be diverted to the private sector. And the other thing is, so the other thing that's happening is, it's pay and use model that is happening. So if you have money, you can, a rich person can go to a 5-star hotel and quarantine themselves and pay money for that, or can go to a corporate hospital for treatment and pay money for that, and or go to a testing facility and pay out of pocket for that and get it. But that choice is not available, for the poor. So the poor, so the alternative for the poor that the government has made available is lacking, and as we know, in public health, our policies should not and cannot be based on how much you can pay. They have to be based on need, and they have to be based on equity, and everybody, so needs to be provided with free testing and free treatment, and the quality of services that all of them deserve, and the quality of services should also not depend on how much you can pay. So that's a big issue, and that we are seeing. The other thing that we are seeing is a huge impact on the health workers, and and I'm sure all of you have been made aware of the problems that the frontline workers are facing in terms of their the lack of their equipment, and it's and the community health workers, the ashas, who are having to go house to house doing community surveys without any equipment, without any training, without being precautions being talked about with them. And so this is in the coming weeks going to be a big issue unless the government really steps in. Along with that, the other problem is now, I mean, all of you've also seen how wages are being cut in the for private sector of doctors because enough patients are not coming. And we also have, a lot of the government hospitals making it sort of mandatory for their staff to deposit, their 1 month salary into the PM fund, and threatening to have some counter sort of action against them if they do not. So that's also of a huge concern. So we next go on to the socio-economic crisis, and I think in the previous webinars there has been some talk on this, so I will not take much time on it. Just to say that I mean the lockdown has really led to a huge humanitarian and health crisis. There's I mean basic denials of the right to food, the right to life, the right to health, and the kind of sort of hunger that we are seeing, and the kind of and all the relief measures completely inadequate on part of the government, and also dependent to a great extent charity, which should, I mean, charitable organizations need to step in, but they cannot be the main sort of main sort of provider of relief. It has to be coordinated by the government and funded by the government. And we are seeing especially a lot of the people who anyways get left out of, for example, the PGS, who do not have ration card, because they're homeless or they're begging on the streets. We have where I live, the waste pickers, collectors are there, do not have their ration card because they could not get the bank accounts made. And now because they don't have their ration card, the relief is for people who have ration cards, and they can get rice. But then for them, it's a sort of a hand-to-mouth existence. So the relief by the government is completely inadequate. If they can get through a toll-free, some line, some helpline, and they're able to convince that person on the other line that they need food only, then it's coming. Otherwise, it's a huge, it's a huge circle that everybody's being made to go around, and and this is something which is not even something that's going to we certainly demanding that the lockdown gets lifted on the 14th. At least, I mean, the general lockdown, the whole India lockdown gets lifted on the 14th with some specific areas could be where some safety measures can be taken with adequate relief measures. However, the crisis that is being created is going to haunt us, is going to be with people for the next week, next month, next 3 months, next year, because then people are not able to earn their living, and it's going to lead to a huge crisis even in the long term in their lives. So the government also needs to be ready for that. And we are really, I think many public health experts and other commentators are actually saying that, there would definitely be now more deaths due to this crisis and this lockdown and the situation that people have been put into due to this lockdown than the total number of COVID deaths that India may see. So what have been so just to talk about the stigmatization and the brutality that people are being subjected to. so we are seeing a lot of victim blaming and criminalizing, especially also of certain communities, and communalizing and profiling of communities, public shaming, and this is going to really hurt our effort, our public health effort, because if people are going to be scared of coming out of disclosing information, it's going to really hurt our public health efforts. Alongside that, we see a lot of state brutality on the poor, on the migrants. Anybody on a cycle going on the street, that person, be sure, is going to be hit by a danda by the police. I mean, that we are seeing here where I live, and I mean, and of course, I mean, the ones in the four-wheelers will not get hit. It's only workers who are going, either the water boy or the sanitation worker who is going for their work, or the who is getting beaten up on the cycle. So we are seeing that a lot. The other thing is violence in the households, because people, the families are being forced to live within the I mean sort of the lockdown within the household, and we are seeing we are finding a lot of increase in violence on women and girls. I think at least nationally, the public, I mean, there's really not been any clear policies on these issues, and specific to this period. And it really, the public, the government really needs to have clear policies on privacy and confidentiality, on the public messaging and sending and communicating the actual messages, rather than fake news that we are seeing spread so much, and also on the violence that is happening, and also responding to the that is happening. Some states have taken some steps, it really, I mean, it has to be done universally, not only in one or two places. So some of the on these aspects, I mean, these are just from the themes, the issues I have sort of talked about. So I mean, our existing, what has been our past policies, that's very important. And the government's response to the response to COVID will be only as good as, as their already existing systems, their public services and their public programs. And I think we are seeing that huge difference even now between Kerala and many other states, and how the government is able to respond. So for example, in Chhattisgarh, we don't even have a public transport service, So imagine if you don't have a state transportation service, and once so a lot of, I mean, the systems are not in place. So then, how do you respond to large scale, emergencies and crises? That's just a small example. I just thought I'd give. Then the other thing that we are seeing, even globally, is that countries with more privatized health systems or limited social welfare programs are really struggling the most, and the governments now need to really take a hard look on the kind of policies, especially the kind of policies led by a lot of the the new liberal ideology that has led to this kind of dismantling of public systems and public programs, and led to more privatized systems. And those are the countries or the states that are struggling the most. So there's a huge learning for governments and the World Bank, if they want to hear it from this. Then we are seeing then the private sector, anyways, was never very willing to be regulated, and they have the scope of dominating even a lot of the public policy making. So that still continues, and you can't expect the government. I mean, if they have not been regulated, even now many states are struggling to regulate them, or trying to control their response to the COVID pandemic. And governments really again need to really step up and take control of the situation through central command. Of course, there is need to strengthen the public health systems and also resource it adequately. The other thing that we found in the relief measures and the other learnings that we have in responding to the socio-economic crisis is that universality is very important, as it ensures that less vulnerable people are excluded. But certainly, I mean, special efforts would need to be made to see that even then nobody else is left out. But as a policy recommendation, whether it's in PDS, whether it's in Anganwadis, whether it's in Manrega, you're finding that wherever there is universality, there is better sort of delivery and better coverage of people and less vulnerable people being left out. Timeliness and adequacy of the measures right now is very, very important. And, we are seeing many states just now, after 10 days, making lists of people who do not have ration cards, and then they will go and, deliver food to them. And I mean, they don't have that kind of food with them right now to, be able to sustain themselves. And also adequacy. I mean, for instance, for example, regular program like pensions. Kerala gives, I think, 1,500 or so to as an old age pension. In Chhattisgarh, it is 300. So, I mean, you can imagine the kind of differences in government and also in terms of adequacy of how much you're giving to the family. At this point of time, I think the one message should be that, nothing is enough. Yesterday we had in the Supreme Court the judge saying, if you're giving them food, why do we need to give them wages? Only food is not enough. Only wages is not enough. I mean, there's so many things, that we need to live our lives. And, you can't just say that, okay, we are giving them one packet of food in the morning, in the evening, and that should be enough to sort of sustain them. So that is something that government, need to realize. And the long term, because we are optimistic, we will get out of this and we will get out of this stronger. But we need to keep demanding from now on things that will help to prepare us better for, any such crisis in the future. I mean, it could be a natural crisis. I mean, it could be a health crisis or a natural crisis, any kind of crisis. So public policies need to promote measures that are based on solidarity and equity, and really not on your purchasing power or on profit or on, prioritizing the rich or differentiating differential measures for the poor. Like seen here, you have so many planes that have been sent abroad, to bring in people, and here, even bring in, people who have maybe died somewhere, and but we just cannot. You're not able to provide buses for migrants who are on the road for hundreds of kilometers walking. Demand for strong public systems and public services, and demand increases in budget. So right now there are a lot of these funds that are being created, emergency funds, including for health infrastructure and for other social welfare measures. But the thing is that, it really needs to be incorporated into the annual budgets, and annual budgets have to be increased, because health workers, you need to recruit more health workers, and they need to be there in the system in the future too. So it is, along with an emergency fund, there has to be long-term funding assured to strengthen the systems. And of course, solidarity across movements and social movements, people's union, workers' unions, people's organizations are extremely required, and to demand this kind of changes that we all sort of believe in, or we want to see. So thank you very much. I think I'll take questions now, and if you want to go through, a lot of documents that have been created both by People's Health Movement Global and by Janswasth Abhiyan in India. So you're welcome to go to the websites and check. Thank you.
Thank you so much, ma'am. That was a very brief presentation, and I think you covered almost everything. especially from different policy interventions to what should be there and what should not be there, and also to other very socially important questions like what's happening right now in India, for example, the stigmatization of one community and based on religious lines and other stuff. So that's I think that was very well presented. Uh, and now I think we'll be taking up questions coming from a lot of friends. Sahil is asking you that how consumer behavior is going to change in the years to come.
Consumer behavior, I mean, in terms of like only healthcare or
Yeah.
okay, generally. Okay.
Yeah.
Yeah. So I think I mean I'm not an economist, but see, I mean I think this would I mean you should not underplay what is happening, and I mean this is a huge shock, uh, economic, social, health shock for people, for family. Uh, so certainly currently, I mean people, majority of the population in our country, you know, I mean, the daily wage laborers, the ones in the workers in the unorganized sector, or even, you know, farmers or forest NTFP gatherers. So a lot of them actually have a hand-to-mouth existence, you know. So your rickshaw puller, the auto wala who's there in locality in our cities, so they lead a hand-to-mouth existence, um, and they're completely penniless at this point of time. So I really, you know, don't think. I mean, in terms of consuming, I mean, they're not able to earn. You know, forget about you know, consuming. So I would say that there would be certainly because of the economic shock, there would possibly be a huge drop in sort of, you know, buying and purchasing power. Certainly, I mean, we are seeing that, and it's going to, like I said, and extend, you know, to a year, to 2 years, to 3 years, you know, in terms of people being able to recover from the economic shock, you know, that they have felt right now. So people are getting used to just having rice, you know, without dal, without vegetables, without a drop of oil in their food, because, you know, that's what the government is, for example, offering. The government is only offering free rice. So they're having it, but they don't have vegetables to go with it, or they don't have oil or dal to go with it. So it's going to be a there's a huge impact on the amount of money that they can, you know, on the money they can get hold of, and also on the nutrition.
So Krishna Swami asks you this, that are the government and the PHCs hiding the data of patients being admitted with severe respiratory ailments since February?
So, I mean, see, I mean, one recommendation that health movements and people's movements have told the government, and which subsequently they added in their testing criteria when they expanded it slightly, is that your severe, you know, your acute respiratory infections, that you test the cases who are hospitalized in the hospital. But there is, I think, there's no similar expansion of testing for the people who come in your OPD, the outpatient department, even though some states have expanded that to people coming to the outpatient department. Now, I think firstly, the number of people coming to health facilities has drastically reduced because one, even many health facilities have also stopped providing services, or they have been, you know, directed elsewhere. The health worker has been posted in a quarantine center. So we've seen a lot of the hospitals or the, you know, the health facilities not closing down, suspending their OPD services. So that is, on the one hand, that is happening. And secondly, I don't even know whether, I mean, your testing criteria and protocol actually does not even tell you to look at such patients in that way, from the primary level. Even though now I think there is an effort to do some kind of a community surveillance where some cases might emerge, but it really depends on the efficiency. In terms of hiding data, I mean, generally, we feel that, there is sort of a underlying sort of an intention not increase the numbers to that extent, and what we need to do actually demand that the people who are clinically suspected of having the infection should be treated. All of them should be treated, and which is currently should be tested, which currently is not the case. And I think some of the data for the influenza type illnesses, that I think everybody needs to check in their own districts whether there's been any spike or any decrease or any sort of purposive sort of covering up of that data.
Ma'am, as you're aware, there are a lot of issues about privacy and competition, privacy and other stuff like going on. So Savita is asking you that question, that could you please elaborate a bit more on that?
Yeah, so see, I mean, it's really like it's actually like a circle. I mean, it's like so if you're not the proper sort of the way how the infection gets transmitted, or what are the precautions. I mean there are some messages which say okay, you should maintain social distancing, your physical distance, and you should cover your mouth and things like that. But in a community setting, then those kind of messages are not being provided on what kind of precautions could be taken, and what are the what is the way of transmission, so that scientific knowledge sort of transmission to I'm not saying only for communities. I'm saying even to your resident welfare associations, which have been so draconic in many of the rules. As we've seen, people trying to throw out health workers from their house, landlord trying to throw them out, and it's been terrible. So it comes out of a sort of a lack of understanding of the way the disease is transmitted, and I think the government has not done enough to provide scientific information and communicate it to every part of the society. Secondly, the other thing that goes with it is the human rights of the patient or the suspected person who's in quarantine. So we are seeing a lot of things like stamping on the hand, and things being posters being posted in front of their houses. So these are all sort of very these lead to a lot of victim blaming and shaming of the person, which I said really doesn't help our public health efforts, and can actually lead to undermining our efforts, and can actually lead to suppressing information about themselves. So the government really needs to, and now we have the Arogya Setu app, which we have huge concerns about huge privacy concerns about, and now we find that it's going to, all that data will be with the government like forever. So so these are the things that the government really needs to counter and act upon.
Burhan is asking you that the fundamental issue is associated with the commodification of health services. So it becomes a commodity in this neoliberal regime, and the right of an individual of getting healthcare or support is extremely undermined. In the midst of this reality, the current health policies in South Asian countries will find it difficult to tackle the pandemic. Do you think this pandemic will transform or take new shape of the existing health policies of these countries?
So we do hope so. We do hope so, and that's why I said it is very important for progressive groups, for progressive researchers, for people's movements to really document this evidence of what is happening, and clearly the discourse is there in the discourse. I think for the first time in decades, people are actually, even in the global north, are talking about how privatized systems have really, uh, 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 sort of had a sort of uh, not responded to the pandemic the way the public sector, the importance of the public sector and the pitfalls of having a privatized health system. So I do believe that this is a very opportune time uh, for us to document this, highlight the failures of the private sector and the way things have been going on till now, and push for stronger public systems. And it is also, it's not only something that's been discussed in like intellectual circles or in researchers circles or academics. It's also something that people like even the middle, the middle class, the upper middle class is also sort of also feeling, at least the ones who talk about these things are getting a sort of a, a taste of what it is and how it is, and if it can lead to universal public health systems uh, for everybody. So it's yeah, I mean, that's the one thing that will come out of this, but it needs a lot of work from ground level campaigning to documentation and to evidence building.
Savita is having another question. She's asking that if the midday meal scheme is still functional, how it could make a difference to children's nutrition.
Um, so So in midday meal, because of because the midday meals are also part of the National Food Security Act. So very early on in the lockdown, the Supreme Court had actually intervened and told states to continue the midday meal. So now we understand that states are giving rice and dal, I mean the dry rations, but of course, I mean I know, for example, in Chhattisgarh they're just giving dal and rice, but no oil or vegetables or eggs in the meal. So definitely that's going to reduce the sort of nutritious efficacy. But it was important that this food is being given. It's very important that this has been made available to the children. And I mean, it was their right, and the money was already available. I mean, it's just part of the money. I mean, it's already available for them, and this needs to be continued actually throughout the summer holidays. So that's something I think we also need to all talk about, that, they might just close it down as the school food close in April or May. And but we need to emphasize that this needs to continue in the summer holidays. And of course, like I said, without vegetables and eggs, I mean, wherever it's not being given, or oil, it does compromise the quality of the meal that the child otherwise would have been getting in the schools.
So, okay. Zuha is asking you, will the government reach out to tribal areas to test for COVID? How is this going to affect the tribal population?
Okay. Is she, I mean, is she asking if the government does that, or?
Yeah, I mean, she's asking you that will the
Or has
government,
it done somewhere?
no, will the government reach out to tribal areas?
Okay. So I think again I think the main thing would be to look at where it's happening, and really do very efficient tracing of cases, and also their contact, which currently has not been done as efficiently. And even if you look at the number of people who had come in from abroad, especially, and also from countries that where we are seeing very severe pandemic happening right now. Even from them, there are people who have come. The government really doesn't seem to have as yet been able to take stock of everybody, or put everybody through a rigorous sort of at least a uh, sort of clinical examination, that kind of thing. So I think things have to be done very scientifically, and the so you look at the cases, you look at people around the cases, you look at who the person who has been infected with, who is COVID positive, uh, who that person interacted with, and so some of our uh, so in that sense, if I mean I would not say that governments have to need to just go into some random area and start testing. It has to be based on some principles. Whether you have people coming in from outside, or you have people who are COVID positive in that area. So that will also help you to prioritize your resources, concentrate on places which need the response the most, and in fact, in many cases, if a lot of the tribal areas have sort of been unreached or left out. I mean, people have not really come into those areas, so they may actually end up also not. Not having a serious epidemic there of COVID. But what is happening in the tribal areas, at least I can say for Chhattisgarh, is there are huge problems in accessing the other healthcare, routine healthcare. So you would see a huge number of illnesses that are not being treated. There could be deaths that are happening, of maternal deaths, and people are not able to reach hospitals in time because distances are large. People may not have bikes, or the man may have the family, the male member of the family may have a cycle, but often for pregnant women to sit on a cycle and travel so many kilometers, it's impossible. So for tribal areas and other areas, I mean, where the COVID positive infection has not reached as yet, the crisis is actually more in terms of they're not being able to get, and the health services and the economic activities that have suspended. So that's going to lead to much higher illnesses and deaths.
Manisha is asking a very important question, and that question is about what role are we looking for mainstream media and development partners to work towards destigmatization? How policy or strategy can be strengthened with government and improve accountability of the government? This is also important because what we are seeing in India right now, the mainstream media, the sort of virus they are spreading right now in the society on the basis of religion, it's uncalled for, and especially in these times. So this makes this question a very important question, actually.
Yeah, absolutely. And I think, you're absolutely correct. And while on the one hand, I mean, we don't want government to gag media, which it is doing under some pretext, gagging a lot of the media, not letting them bring out a lot of the stories. But on the other hand, you're seeing media bring out such fake news and fake information, and the government not taking any action on it. So I think some of for example, the state governments have done. I mean, I know that, for example, the fake news that has been circulated. Some state governments have been proactive in sort of saying that this is a fake news and actually talking about what the actual information was. But of course, we are seeing that very less in many few states, and certainly not with the national government. So we really need to see. I mean, so the issue is also that because physically we are not able to come together. I mean, it's important for us, even as movements and campaigns, build solidarity the way we can wherever we are and the situation we are in, and keep pressurizing the government to act on that. So, and part of the stigmatization and the like I said, victim blaming is due to very inappropriate or wrong messaging by the government and by the media. So government first needs to have a good policy on trying to counter some of these things which the government really does not have. And I'm hoping that people who really want the government to respond on this can come together and maybe demand some accountability through some methods from the government.
I think we don't have any more questions, ma'am. Uh, Thank you so much for being part of this conversation with us and accepting the invitation from Tricontinental India. Uh, and thank you everyone who was part of this talk today. We'll be coming up with next set of series and we'll be trying to invite people from all over the globe this time. This was more or less India centric. We'll try to bring in a new set of speakers, especially from say different countries, to understand the situation in those countries and what are the effects, especially say someone from US or Europe or China. And so yeah, till then, thank you so much. Please subscribe to us, and thank you for your mails. We'll get back to you. Thank you so much, ma'am.
Thank you, everybody.